You start doing lasers, you see that every second person wants to get a laser done. We started like that. We had a hitch when we bought a laser thing. We said we can't compare it with a conventional, therapy. You can't compare. After all, a surgical blade or a knife is best as compared to. No, it is not like that. Now patients are so aware, especially in pediatric dentistry. You see, even in our institute, we have a laser in the pediatric department where they are using on and off the lasers for every procedure, though it is limited only to the soft tissues. There is a lot of disadvantages also, that it is more expensive, like you can't afford to buy a hard tissue lasers because they are very expensive. But a soft tissue laser can do a magic. It can do so many things that which even a conventional, you can't say it is a replacement for conventional. It can be an adjunctive or an alternative for conventional therapy. So with this all advantages, Victor has noted down, he has given that it is, these all are the advantages. As I already said, it gives a dry field, a bloodless areas, instant sterilization of the surgical site. You have reduced bacteremia, you have reduced mechanical trauma, swelling, pain, and finally comfort to the patient. It was based little, I'm going, it's a vast, physics is a very vast thing of lasers. Very little, it is based on the Albert Einstein's theory of spontaneous and stimulation emission of radiation. Okay, so depending on this basis or this theory, Tones, he came up in 1957 with maser, that is the microwave amplification by stimulated emission of radiation. Finally, the first laser prototype was introduced by Myman in 1960. He came up with a laser known as ruby laser. It's no more, not much, no use now. So he was the first one to be the pioneer in the development of lasers. Followed by 1961 was Sidzer. He came up with the NDAC laser. That is, the NDAC is the neodymium yttrium aluminium garnet. It's the full form of the NDAC laser. He came up with the NDAC laser. After that, there were a lot of people who did the development, like Goldman. He came up with this use of this NDAC lasers in dental tissues. So it was again followed by Myers and Myers, who came up with the use of carbon dioxide and NDAC lasers in soft tissue surgeries. So these all were the pioneers in the laser development. Finally, it was only in 1990 that the US Food and Drug Administration named the carbon dioxide and NDAC and diode lasers to be accepted for soft tissue surgical procedures. So it was finally, it was in 1990 that it was approved to use it in soft tissues. Laser, we all know, we have read that it is a light amplification by stimulated emission of radiation. It has a little difference from the ordinary light. It is different from the white light. It is that it has got a significantly 3 characteristic features. It has a coherent, monochromatic and collimated type. It has got extra 3 characteristic features. This coherent means all the light waves we see, they have got a spatial boundaries. That is, it ensures that there is a specific size and shape of the light waves which are emitted from the laser beam. Monochromatic is that each laser light has got a single color or it has got a single wavelength. Collimated is that the beam which is emitted from the laser light, it has got all same shape and size, similar. This is all the light waves are same, that is the this valleys and peaks are all identical. Here the beam is identical, having this specific shape and size. So these are the 3 characteristic features which you can differentiate between the ordinary light. Now in dental lasers, mainly like lasing process occurs mainly because of the atom. It's a basic unit of energy is photon for this, and mainly it is because of the excited atom. When it gets stimulated, it emits a photon, and before the process occurs spontaneously. Now there is spontaneous emission of the photons by the excited atom before and it releases the subsequent photon and so on. So these usually the lasers, you have dental lasers which are used in dentistry. They have a wavelength of 500 to 10,600 nanometers. Now what is this wavelength? You're confused. Like there are varieties of lasers which come up in the market. You have diode lasers only, which are like, they say 810 nanometers, they say 980 nanometers, they say 635 nanometers and all that. This wavelength means that the distance between two waves is called the wavelength. Okay, so the highest peak of a wave, the distance between the highest peak of a wave is called the wavelength. So the dental lasers lie between 10,000, this range, and they lie between the visible as well as non-visible infrared, non-ionizing portion of the electromagnetic spectrum. So you have lasers from 488 to 10,600 dental lasers. So they lie in this range. So you have a visible light, you have an infrared light in the lasers usually. So they are different from the UV or the this one, microwaves. So they lie in between this portion of the electromagnetic waves. Laser, it contains, we know that, I'm not going in detail, but just to know the basic, laser has an active medium. It is in a resonant cavity, and usually it has a foot control, it has a cooling system, you have the reflective mirrors, you have the lenses, okay, and it is connected to an external power supply. Usually the lasers are named after the active medium it contains. Suppose the active medium is gas, then it is a carbon dioxide. If it is the active medium is it is a solid crystal rod, then it is a erbium. If it is a solid, if it is electronic device, then it is a diode lasers. Okay, so now usually when a laser beam, it touches the tissues, then that is called as a laser tissue interaction. Okay, so when it touches, usually when it touches the tissues, when it encounters the target tissues, easily it either reflects, it scatters, it transmits, or it absorbs. Various type of lasers have different absorption capacity. So usually this laser tissue interaction, it mainly depends upon the type of the tissue. Okay, the target tissue, because the laser is focused on the tissue. So what is the type of the tissue, optical characteristic of the tissue? It depends upon the type of the wavelength you have used. Okay, and various factors. There are variety of factors which can affect this laser tissue interactions. This is very important because if the factors are up and down, it can cause severe heat changes, thermal changes in the tissues. So these factors include, you have the type of the wavelength, you have the pulse rate, the pulse duration, you have the vascularity of the tissue. It depends upon that. It depends upon also how you have used it, whether you have used it in a contact or non-contact mode. It depends upon the heat conduction, how you have done. So all these laser tissue interactions can be a very smooth one. It can be overheated and cause toward reactions. So these are the factors which have to be considered while the tissue is in contact with the, when the laser is in contact with the tissues. So as I said, these are all the factors which encounter this. Now we should know so many types of lasers, where they are used, it is a confusion. Basically there are two types of lasers. You have the hard tissue lasers and the soft tissue lasers. Hard tissues have got a deeper penetration, increased penetration, that is the erbium YAG. You must have heard about erbium YAG lasers and carbon dioxide lasers. These are little expensive, but they have got a fantastic use. They can be used for hard and soft tissue procedures. And you have the soft tissue lasers, which is the diode laser, which we have in our institute. You also have, which has multiple uses. So these are the soft tissue lasers. We call it as soft tissue lasers. Then it depends upon the wavelength of the beam. You have various wavelengths. As I told you, what is wavelength? So you have the light, visible light, infrared light, depending upon what is the wavelength. Okay. And then you have, as I told you, even depending upon the active medium of the laser, it is named after, like you have the gas, that is a carbon dioxide. Then you have the semiconductors and the solid state lasers. But we remember only hard and soft tissue. These are just various classifications have been given, but we are not so much bothered of all these classifications. We just want to know the hard and soft tissue lasers. Then depend on the pulsed or non-pulsed mode. Pulsed is when the beam is not continuous. It is like pulsating. It is like a blinking on and off. Whereas a non-pulsed is the beam is continuous. Okay, it is based upon the mode of action. you have the contact mode or the non-contact mode. So contact mode is when the laser is in contact with the tissues. Non-contact mode is when it is away from the tissues. Various procedures, I'll be showing you some pictures where we use the non-contact mode, that is, it is away from the tissue, especially for treatment of desensitization. You want to do a hypersensitivity treatment, you do in a non-contact mode. Now coming to the types of lasers, you have one is the argon laser. Argon laser is not actually used nowadays, it was used previously. It is having a nanometer of 488 to 514 wavelength. So it is like you have the 488 to 514 nanometers wavelength. Usually this was used mainly for caries detection initially. Now we have better lasers which are come into the market known as a Dignodent. Okay, that is a low level lasers which are used for the diagnostic purpose. You have for the various diagnosis of the caries and all that, it is called as Dignodent. Then you have the main is the diode lasers. Diode lasers are, they have a wavelength, they come into the market at the wavelength of 635 to 980 nanometers. You have various types of wavelengths. So it can be, it is the one which is most commonly used for soft tissue procedures. You can use it in contact, non-contact mode, you can use, and you can use it for various type of periodontal surgical procedures like gingivectomies and depigmentation, frenectomies, operculectomies, desensitization. You can use it for pain relief. Nowadays we are extensively using lasers for TM joint disorders. We are using low level diode lasers in a non-contact mode. You know, you use it externally for you know, the TM joint disorders, which is not very much in where there is a muscular or a joint disorder, then you can't use it. But when there is severe pain and all, it has shown to cause fantastic results. We have tried on patients in a non-contact mode with 0.5 watts in a like about 3 cycles, and it has shown excellent results. And it is used for even various like we know diode lasers we have used, so we know like so many. It is well observed in the pigments, so it is fantastic for the hemostatic agent also. It can be act as a hemostatic agent. These are the other lasers, that NDAC lasers with wavelength of 1064, and these also are used for soft tissue cutting. You have coagulation, you have for hemostasis similarly, but these are little heavier lasers. Then you have the erbium families. These are the hard tissue lasers. These erbium lasers, there are of 2 types. You have the erbium YAG lasers and erbium chromium YAG. That is, you must have heard about water lace. Water lace is the erbium chromium YAG. I think MAMC has the water lace, this one, which is fantastic for tooth preparations. So this erbium chromium YAG, these are the hard tissue lasers. These having the wavelength of 2780s, mainly used for bone surgeries, and you can use for tooth preparation, especially very good for cavity cutting, very good for caries removal, very good. It is just so fantastic to work with it. It is done with both non-contact, contact mode. Either you have different tips for it. So if you want to do a contact, you use a tip and then you touch the tooth and you can do the cavity preparation. Otherwise, you can do it in a non-contact with the focused light, and then it just goes on cutting very nicely since it is absorbed in the water and hydroxyapatite. So it is fantastic for the root preparation or the tooth preparation or the root canal therapies. And this is usually it comes, I said, water lace, erbium chromium YAG, water lace. Then there is only erbium YAG, again same properties, but the wavelength is different. It has 2940, and they have, as I said, they have a good affinity for water and hydroxyapatite, so they are being used in hard tissues. And then you have the carbon dioxide lasers. Again, this has got 10,600 nanometers, and it is named after the active medium that it contains, that is the gas. Again, it is good for soft tissues like cutting, coagulation, incising, or hemostatic agents. Then I said about the water lace, which is a new type where the MAMC Institute has it. It has got a cooling system along, and it doesn't make any noise, it doesn't have any vibrations. It smoothly cuts the tooth, very high power, and it just cuts the tooth like beautifully without any heat production. So it is only a disadvantage of this is it's very expensive. It costs about 35 to 40 lakhs, and but very beautifully it can be used in root canals. This was the little bit description in short basics about this. Now hazards. See, hazards we should know, because as a laser looks, it's not that very safe and very this. We have to see that we take lot of precautions when we are using a laser. Now, there are various hazards which have been given, like you have the ocular, the commonest one is the ocular hazards. The main primary potential injury to the eye, it can occur because of the direct emission of the light from the laser beam. You should always wear eyewear. Otherwise, it's so powerful that it can injure the eye, direct emission, or it can be even because of the reflection from the mirror-like surface of the instruments. Now, most of the dental instruments, they have the capacity to produce reflection. So, this reflection can cause tissue damage to both the patient as well as the operator. So, we have to use a eyewear while doing a laser therapy. And most commonest injury to the eye is the sclera or the corneal burn, and even permanent blindness also has been shown to cause in some of the cases where the this incident energy is converted into heat energy within fraction of seconds. So a lot of precautions while doing this. Even the person who is standing next to should not focus on the light beam which is emitted from the laser cavity. So that ocular hazards, these are the commonest. Other ones is the cataract, aqueous humor, then you have the even injury to the sclera. Tissue damage can occur when the laser, it can damage the skin, adjacent skin. Suppose you're working in the oral cavity, it can cause skin damage, or it can cause even on the non-targeted tissues, because when the temperature is increased above the body temperature, suppose 21 degrees above the body temperature, it can cause untoward damage to the skin or the tissues. Like especially you have the cellular destruction at the metabolic this level or molecular level, you will have destruction of the tissues. So this can lead to tissue damage. Respiratory hazard is one of the most commonest hazard, because this has shown, like a survey which was conducted by National Institute of Occupational Safety and Health. They had evaluated the air from the operating room, and they found that traces of mutagenic materials, particles were found in this plume. So that if you inhale or you take that aerosols inhale, that can cause untoward damage to the respiratory system. So that is also one of the damage. So you have to use lot of precautions for that. Then you have combustion hazards. Combustion hazards is whenever there is a materials in near to the laser, it can cause additional hazards like flammable materials, like you have the clothings, you have the paper products, you have the waxes, you have the various gases, and you have the liquids which are present in the operating site. Any laser in contact with that can cause an additional hazard. So these materials, these flammable materials should be kept away from these laser cavity. It should be kept in a closed closet or in the cupboard or covered it, so that no untoward hazard can take place. Last is the electrical hazards. We have the electrical hazards is, since these lasers have got a high potential electrical current in it, so any accidental can cause fire, it can cause shock, it can cause untoward any any explosions, so it can lead to any shock. So that is another this one. Plume is the smoke which is emitted, okay, during the laser, when the laser is in contact with the tissues. This plume contains lot of cellular debris and particulate matter, which is again hazard to the respiratory system. Now I'll just go to the changes, because this is a very this is something which we call it as charring or carbonization. When the heat is increased, we try to increase the watts, we try to increase the temperature so that it cuts very easily. but that can cause charring, it can cause carbonization. You see the discoloration. This can lead to the death of the tissues, and this can lead to, not proper healing. It may lead to reduced blood supply. So untoward, you get this one. So it is better that you use to the specific this. These are some of the SEM studies we can see when after scaling and erbium, which has shown irregular and rough surface. We can see a SEM surface. Here also we can see that there is a oral cavitation on the root surface when we used a diode laser. So this also, when excessive heat is used, so it has caused the damage to the root surface. Here we can see also there is a cracking, surface cracking and fissuring. If you see, this is like when we see in a SEM scanning electron microscopy of the root surface, we can see that they showing the fissuring. And also here severe damage to the root surface by using the carbon dioxide, which is again more heat is created. Here if you compare these two slides, see, if you see only without a laser irradiation, there is how you see how it is, the dentinal surface looks like. But when a laser was used with excessive heat, there is melting. You can see the comparison how this was used. Okay, so these are the effect which can occur. See, here also there is one specimen where NDRK's laser has shown char on the bone surface. We can see a histopathological picture showing that. So protection is a must. So we have to protect ourselves. One is the adequate eyewear is a must, as I told you how it can cause damage. So all the assistant, the operator should wear this eyewear. Secondly is that use of high vacuum evacuators to prevent plume. I said plume is so hazardous to the respiratory system. So use an evacuator so that the plume is not created. Third is you use wet gauzes which are placed on the surfaces of the tissues so that there is no damage to the skin that can take place. Then precise knowledge to use the lasers, a good wavelength, don't over put the wavelength, don't over put the power or the pulse duration. See that you put it properly, and always the laser should be on the standby when you're not using it. There is a button where it shows standby and it's ready. So when you're not using it, keep it on a standby position. So all these simple precautions you have to take to prevent any untoward damage to the this. Now I'll show you some pictures where we have done on different cases. So these are the various branches of dentistry where laser actually can be used. Okay, it can be used in all the branches. Implants, now so much, any peri-implantitis, they refer the patients for second stage surgeries. The cases have been referred for implant with laser exposure. Then you can use all these type of lasers for the initial periodontal therapy. We start with the Perio. Perio case, mainly we do lasers. We use lasers for various advantages. One is it promotes the periodontal attachment. It removes the bacteria. Debridement, we say, pocket debridement. It eliminates the bacteria from the pocket sulcus, from the pocket. Then thirdly, it causes debridement of the root surface. You can use it. And fourthly, you can use it for desensitizing, like dentinal hypersensitivity. You can use this. Here we have marked the pocket. Okay, we have seen. Now the fiber, the periodontal probe we have marked. Suppose the pocket is 5 millimeters. You want to you say 6 millimeters. You take the fiber tip, measure how much is the pocket. Like the pocket was 6, so you measure the periodontal this laser tip also 6 millimeters. You have to take care that you should be always 1 mm beyond the pocket depth. Like means less than the pocket depth. Suppose the pocket was 6 millimeters, you're going deep as much as 5 millimeters, 1 mm above the base of the sulcus. So you measure, then what you do is you place the fiber tip. Okay, you start from the tip of the sulcus. You start from the tip till you go to the base, 5 millimeters. It's a 6 millimeter pocket. I am doing 5 millimeters. So I start from the tip. So you start from the entrance of the sulcus. You go up to 5 millimeters into the sulcus. Okay. in a coil-like fashion. You have to go like this, like a coil fashion. So you engage the tissues, and then you, in a sweeping motion, you engage on the side of the pocket. See that you don't penetrate. You just go into the pocket and just give a coil-like fashion from the tip to the base of the sulcus, 1 millimeter above the base of the sulcus. So until a bleeding, you can repeat it for 2 to 3 times until bleeding comes, little bleeding. That shows that this cycle is over, one cycle. Okay. So you can do a repeated 2 or 3 cycles in an interval of time, about 3 days a gap. So you can do this this is pocket debridement. This is pre and post. Again same thing with a diode laser. This is a endoperio. Endoperio was good. What you you have a pocket, so you have a endodontic problem also. So this access opening is done, the pulp is extirpated. After that, when you're doing a PMP, after you do that, you can lace the area, you can lace the sulcus and the root canal. Okay. So root canal, again you go first to the apex. Like in pocket, you're going from the top to the down. From here you go from down to top. Again in a sweeping motion, 2 millimeters away from the apex. Okay. First you measure how much is it, and then 2 millimeters away from the apex, you go down to the root, down and to the apex, and then you go in a coil-like fashion, you come up. Okay. So this is where you do the root canal disinfection as well as the periodontal disinfection. Very good results. It has shown lot of cases we have done on endoperio, and it has excellently done. We had done a study, and so it has given a very good results. Then again it can be used, hard tissue lasers can be used for root biomodifications. Then here we have a drug-induced gingival enlargement, a very fibrous gingiva, so it is very difficult actually with a diode laser. It has caused little charring which should have not caused, but the healing took place quite well, and then it has given a good result. Then this is again a frenectomy. Okay, so frenectomy plus you have a depigmentation. So you have a frenum which is removed with a 980 nanometer diode laser and with the 2 watts. We should see that usually they give you 2 watts, 1 watt, 1.5 watt. It doesn't depend. You start with the lowest, that is 1.2 or something. You do not increase suddenly the highest watts. It may cause suddenly burn. So with little you can increase the this one. You can increase it, but because suddenly if you start with the highest one, you may cause untoward burns. So start with the smaller to the larger, and it varies from patient to patient. It is not that 1.2 for frenectomy means I will use only 1.2. It may be even in 0.8 you can do a frenectomy. So it varies from patient to patient. So it should be used accordingly. This is again a depigmentation which we had done with a carbon dioxide laser. So it is again in a non-contact mode. It is like not touching. It is just that the light beam is placed on the, and you just move accordingly. You move the laser accordingly on the gingival surface. Then this is a operculectomy. You can see that a nice operculum, you could remove it. Frenotomy, a case of frenotomy. Dentinal hypersensitivity has shown excellent results. We have treated, see, we have used laser without agent. There are various agents, desensitizing agents in the market. We have the stannous fluoride, strontium chloride, and potassium nitrate, and lot of things. But what has happened is only with laser it has not given very good results. We have used along with stannous fluoride. So a thin, you dry the surface, and a thin layer of stannous fluoride if you apply and you focus the laser light, and at a 0.5 watts, okay, and within a non-contact mode. Don't touch the tooth, away 1 millimeter away from the tooth, and then you don't keep it constant on one area, you just keep on moving it. Okay, so this you can do it. That also helps in this one. See, here is only with laser we have doing. There was this one. Second case where we did is we dried the surface and applied stannous fluoride and did the desensitizing. Yeah, it has shown a good result with the stannous fluoride. Then this was in a pedo case, so there was exposure immediate after crown exposure. So this is after 1 month of crown exposure. This is again, it's not, we have not done because it was done with the Urbimia, the tooth preparation was done, caries was taken out and preparation was complete. And lasers have used in fantastic in aesthetic surgeries, like you can use in aesthetics bleaching. Bleaching has done fantastic with lasers. Now this, even the smile design, this case, especially when we do a smile design, we take two things. One is hard tissue component and the soft tissue component. For us as a periodontist, we look for the soft tissue component. Soft tissue, we mainly see the embrasures, we see the gingival zenith, we see the level of the gingival margins, how it looks aesthetically. Okay, so these three, taking into three considerations, we mark the midpoint of the highest point of the tooth. We marked it in the mid buccal area, and then it was with a diode laser. This was like, you know, done. So that nice contours are maintained, that the contour of the central and the canine is at the same level, and then it is lateral is about 0.5 below that. So here we lastly measured it with the dental floss. We saw how is the margins to see it has come out well, and we can see that there is a good difference. If you see here, see the margins here and here. So this has shown a good, it has given a good smile design. Then here also for a gummy smile. Okay. So a good margins. Bleaching, see there are various types of bleaching agents, but for a laser, to use a bleaching, there is something called as laser white 20, okay, gel. I think you all must be knowing as a conservative that it is a gel. I don't know if it is available. It is mainly used with along with the lasers. This is in a gel form which contains 45% of hydrogen peroxide. So what we do is actually this Zolar which your institute has, it has an extra handpiece. It has one handpiece mainly for bleaching. But you can't use the same bleaching agent what you're using in conservative. You have to buy this laser bleach, and what you do is, first is you clean the surface of the teeth, you dry the surface, then you place this liquid down. Okay, this is a gingival protector, so that the gingiva is not damaged. You do this, okay, you light cure this so that it remains in place, this liquid dam. Then you take this handpiece, it's along with a Zola, it comes along with Zola. What you do is, this laser white 20 is a bleaching agent, gel, which is a thin layer is applied on the tooth surface. Keep for 5 minutes before you laser it, just leave it on the tooth surface for 5 minutes. Then what you do is, you take this handpiece and then you laser it, you laser it like for about 30 seconds. You each tooth 30 seconds you laser it, and then you then what you do, you repeat it again. 2 cycles you have, immediately you repeat. Again thin layer of laser white, again you laser it for 30 seconds. So 1 cycle is over. Then what you do, you clean that surface. You just flush it, clean it off, dry it again. Again repeat this 2 cycles. That is, apply the liquid, the gel, leave it for 5 minutes, laser it with 7 watts, and then for 30 seconds, then again 1 cycle. So 2 cycles, fantastic results I am telling you, like bleaching has shown you can finish it in 1 sitting. Really, it has shown some only 2 cases we had done, but both the cases in our course, both the cases showed fantastic results in bleaching. Maybe if it is a very intrinsic bleaching which has got too much, it is not in 1 sitting, you can recall the patient after within a week for the second round of the same procedures. So bleaching can be done with this. Lasers in implants you can do second stage, okay, to expose. You can do for peri-implantitis, again very good, okay, very good used in peri-implantitis where there is inflammation around the peri-implant mucosa. You can lace that area to eliminate all the bacteria. Very good along with your mechanical therapy. So you can use it. NDR should not be used in implants because it may ablate the titanium surface. So you can use, best is diode lasers. If you have a diode laser, you can use it along with the implants of this. Okay. So this is again this is just taken from somewhere. It's a helium YAG laser where they have again used it, and after 2 months. So this is again laser which is used around the periimplantitis to lace that area. Just lace it with a low, it's called as biostimulation. Biostimulation means non-contact mode, very low level, okay, laser. So you can just, lace that area about 30 seconds to 1 minute, and it gives a good result. This is post-operative where the laser was used. In other areas we have, in oral medicine, it has been used variously. Here we can see a flabby ridge, okay, that is not oral medicine. This fibroma, there was a fibroma, big fibroma where the laser was used. Immediate post excision we see, and after 30 days we see that there is no sign of anything, it is completely healed. This is again from, we have not done it, it's a hemangioma case, again used because bleeding is there lots in such cases. So since it has got a fantastic hemostatic agents, you can use this on these lesions. Photodynamic, yes, we use it, we do it regularly. We don't do it properly, I'm telling you, because I also have given thesis and it was not done according to what actually has to be done. Photodynamic, we know that they generate usually the free oxygen species. Okay, it is a photochemical reactions which is initiated by the lasers. What we do is we use a photosensitizer, toluidine blue or the methylene blue. Nowadays indocyanine green is come. We put it in, there is a pocket, we put this one into the pocket, dye, and then we lace it. How we used to do is, we used to lace it at the entrance like this, like this, like this. It's not like that. Suppose again it should be done like a pocket debridement. How we go deep into the sulcus, you have to go deep into the pocket in presence of the presence of the dye, and then you have to lace in the same way as the sweeping motion. So it has to be done like that. How you do a pocket debridement, like that you are doing photodynamic along with a photosensitizer. So that shows very good results, and with the laser photodynamic. So it has been low level lasers are lasers with a single wavelength. They are like with very low wavelength, and they can be used on variety of cases. Like you can use low levels in all these areas. Okay. So it has been used, as I said, for TM joints disorders, pain. We have used, and it is showing a good results. So to end, like, since it's a very big, each topic has, we can speak on endo, we can speak on perio and all that, but just a basic, so that you will know what types and what are the indications. So lasers, as we said, it is the newer technology. It has been, and it's been used as an alternative or an adjunctive to the mechanical conventional therapy. And lasers, they have got much advantages as in regards to the hemostasis, decontamination, post-operative pain, less good comfort to the patients. And you never know in future, coming future, lasers can be one of the essential component in the comprehensive dental practice in these days. So they may be, some dangers are great, but the rewards are excellent. So with proper precautions, lasers can be used fantastically. Thank you.